Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapists. You are watching the Need to Know show. For this episode, we're going to talk about TENS. What is it? What are some of the pros and cons of using it? And how should you use it if you do decide to use it? So TENS, T-E-N-S, stands for transcutaneous electrical nerve stimulation. So transcutaneous, if we break this down, transcutaneous, so through the skin, electrical, so it's electrical current, nerve stimulation. So it's a very light, low intensity, very controllable, manageable electrical current that is going through your cutaneous tissue, your skin, and the layers out, the superficial part of your joint in your body, and stimulating the nerves in the area that you have the pads on. So typically what people do who use TENS will have a handheld device which is about the size of your hand, probably a little bit smaller than like a Game Boy, something like that, or a little bulkier maybe than a phone. And you have the device and there's wires, so you connect the different wires to the leads in the device, and then the other end of the wires are connected to pads that you're going to put on your skin. So for knee replacement and for knee pain, what I like to do is put the pads in a diagonal pattern. So typically I'll put 2 up on the top here and out a little laterally. If you have bigger pads, you'll cover a little bit more area, but it will be a little more dispersed. If you have smaller pads, less area, but a little more intensified to that specific area. So 2 kind of up above the knee and 2 on the outside just below the knee. So 2 and 2. I usually like to use 4. If you have just 2 pads, you can do them 1 on each side. Works good as well. All right. So what exactly it's doing is, so it's sending this electrical current from your handheld portable device system, goes through the wires, through the pads, through your cutaneous tissue, your skin and other tissue, and stimulates the nerves. And the goal of TENS is for pain relief. There's other forms of electrical stimulation that have other goals, such as muscle contraction is the main one, the main other goal. But when you specifically talk about TENS, you're talking about pain relief, using electrical stimulation for pain relief. And so some of the pros, some of the cons. Some of the pros is, one, it can provide some pain relief, which is of course helpful and good. And it's a non-invasive way and relatively safe way to provide pain relief. As long as you're following all the procedures, you're making sure the device, there's no, it's working properly, there's no cuts or opening in the wires or anything like that. Relatively safe to use. There are some contraindications if you have certain skin conditions. If you have a pacemaker, you can't put it over the heart. If you're pregnant, you shouldn't put it on the belly or anywhere around the abdomen. But around the knee, relatively low contraindications or reasons why you can't use TENS. Some other positives are it's portable. It's something that you can do. You don't have to be in physical therapy to use it, so you can buy one relatively cheap, or maybe even get it through your insurance and use it at home. You can use it as much or as little as you'd like to. And it's just a nice little adjunct to have to your therapy. I like to have people who want to use it, they'll put it on for maybe 15 minutes, a half hour, get some pain relief, and then they'll go and do their exercises, or they'll just be able to tolerate their regular daily activities a little bit more. And that's kind of how I like to use it with my clients in the clinic. Some of the cons are some of the negatives. One, it's a very passive form of treatment, so it's not something that you're utilizing your body, you're not actively building strength, you're not actively building range of motion and getting back to activity which is the main goal that you want to think about. So anything that's passive, there's always that risk of becoming a little too dependent on it, using it too much, when it's really important to use some of the more active exercises and activities that are also more, a little bit more self-empowering, build self-efficiency as well, self-efficacy. And that's a negative. Another negative is that it's very transient. The benefits are really just short-term benefits. They last for sometimes just when you have it on, sometimes for maybe a little while. After you take it off, the benefits, the pain relief might last a little bit, but usually it does not last more than maybe a couple hours from the time that you take the TENS unit off of your body, off of your knee. So it's very transient, and there's really not much research that shows that it provides a long-term benefit in terms of pain relief, improved function, improved mobility, anything like that. So it's very much a short-term kind of an adjunct type of treatment, type of modality to use. That being said, of course, it's relatively cheap, relatively low harm. So I kind of like to put it in the same category as using ice, using heat. Feel free to use it. Don't become dependent on it. Don't think it's your main thing that you have for treatment, but if it provides some pain relief, provides a little benefit, then I think it's perfectly okay to use a TENS unit. So why does a TENS unit provide pain relief also? Is the theory is what we call the Gait Theory. So this theory has been a little controversial, and they're not really sure if this is the main way that a TENS unit causes pain relief, but it's kind of the most prevalent one out there, so I'll share it with you. And what it means is basically your knee and the structures and everything around the knee, there's pain sensory signals, and they're picking up these noxious stimuli, we call them, these stimuli that cause pain, and they're sending that signal through your nerves up to your spinal cord and between your spinal cord and your brain, and then back to your nerves, and telling you that you have pain, you have discomfort. So it all starts with that signal from some sort of stimulus sending up from your nerves to your spinal cord to your brain to make that perception of if there's pain. If we block that signal by sending another signal, such as the signal of what you feel from the electrical stimulation, then that's going to block that pain signal, and instead you're going to get the signal of the electrical stimulation coming up into your body, into your brain, and that's what you perceive. It's a similar idea to if you have a sore knee or a sore body part and you rub it, so you start to feel the sensation of the rubbing instead of that sensation of the pain. Similar concept, just another way to provide that relief a little bit more long-term, longer duration, not necessarily long-term, but a longer duration without having to rub the knee for constantly. All right, so that's the TENS unit, kind of what it does, some of the pros, some of the cons. Again, if it provides relief, it provides benefit, then feel free to use it. Just realize that it's similar to the ice, similar to the heat, more of an adjunct, more of something that you do in addition to your exercises, physical activity, all those great things. All right, this has been the Need to Know Show. Thank you very much for watching, everyone, and have a great rest of your day.